afternoon. I call this meeting on social development to order. My name is Katrina Knockleby, and I am the MLA for Great Slave and the Deputy Chair of the Standing Committee on Social Development. We are currently conducting a public briefing on Bill 80, Dental Hygienists Profession Statute Amendment Act. Bill 80 is a private member's public bill advanced by MLA from Cam Lake. This bill proposes to provide dental hygienists with the option to work independent from a dentist. As part of committee's review of Bill 80, we are holding a public hearing which is being live streamed on all Legislative Assembly channels. Thank you to those who are listening in and for those in attendance. I would like to remind all members and presenters to pass all questions and comments through myself as the chair, and please wait to be recognized before speaking, as this will allow for a smoother transition. I will now ask all members to introduce themselves for the record, starting on my left.
Good afternoon, everyone. Rylan Johnson, MLA for Yellowknife North.
Kevin O'Reilly, Frame Lake.
And those online?
Lisa Semler, MLA for Inuvik Twin Lakes.
Ron Bonadouche, Decho, Massey.
Thank you very much. I will now pass this over to the MLA for Cam Lake to introduce herself and to proceed with opening remarks and presentation. Thank you.
Thank you very much, Madam Chair. My name is Caitlin Cleveland, and I am the MLA for Cam Lake. Thank you, Madam Chair and colleagues, for your time today and invitation to appear before committee to speak to Bill 80, Dental Hygienists Profession Statute Amendment Act. This act amends the Dental Auxiliaries Act and the Health and Social Services Professions Act to require the Minister to recommend to the Commissioner regulations under the Health and Social Services Professions Act on or before March 31st, 2024, to regulate the practice of dental hygienists, designate the profession of dental hygienists as a profession effective April 1st, 2024, transfer the regulation of dental hygienists from the Dental Auxiliaries Act to the Health and Social Services Professions Act, and replace gender-specific language in the Dental Auxiliaries Act with gender-neutral language. Today I would like to speak to why oral health is so important to preventative health care, why I have brought this bill forward, and respond to the points raised in the public letter to the Standing Committee on Social Development from the Minister of Health and Social Services dated May 4th, 2023. Our health has a significant impact on our overall health. Our oral health has a significant impact on our overall health. Today, almost half of the world's population suffer from oral diseases, and global cases of oral diseases have increased by 1 billion over the last 30 years. The most common oral diseases are tooth decay, severe gum disease, tooth loss, and oral cancers. Poor oral systemic health also directly increases risk of diabetes, cardiovascular disease, cancer, Alzheimer's disease, periodontal disease, and high-risk pregnancies. Every one of these jeopardizes a person's quality of life, may shorten their life, and is a significant financial cost to the government. The operations budget for the Department of Health and Social Services of the Northwest Territories is $500 million, and the cost of healthcare is not going down. In fact, our expectations of our health department continue to grow, and the associated budget is not keeping pace. Changes to prevention have the potential to have long-term culminated significant impact on the government's bottom line and the quality of life of Northerners. So why Bill 80? Here in Yellowknife, there are multiple dental hygienists that residents can access dependent on financial and benefits the individual has. But in our remote communities, access to regular dental care is not consistent, and treatment is not timely or immediate. Accessing treatment is complicated by the fact that dental services are not insured medical services under the Canada Health Act. Depending on an NWT resident's ancestry, their funding for dental care and funding contracts that potentially bring oral health care to their community comes from a different funding and benefits pot. And given the current legislation, it makes it hard for contracts to be tendered solely for prevention. Today, the Dental Auxiliaries Act stipulates that no dental hygienist shall practice dental hygiene except under the direction and control of a dentist. In our last session, the Health and Social Services response to oral question 1435-19(2) stated, quote, access to dental services for Indigenous residents eligible for the non-insured health benefits program is funded by Indigenous Services Canada through a contribution agreement with the department. The department, on behalf of Indigenous Services Canada, enters contracts to pay for the travel costs of dental providers to provide dental services in communities. Indigenous Services Canada determines the number of dental days allotted to each community and funding in accordance with this number, end quote. In reality, how services are delivered on the ground across our territory differs than how they are intended. Yes, there are contracts for dental providers to travel to northern communities. But on the ground, this means that outside of Yellowknife, dental providers offer dental services in short blocks of time where services are triaged starting with dental emergencies. This makes sense if someone needs a root canal or an extraction. This will always be the more emergent case. But this means prevention is routinely pushed back or simply does not happen, and the next visit is more teeth being pulled and perpetuates a cycle where preventative care consistently sits on the back burner. Separating dental providers to allow the option of dental hygienists to work independent of a dentist is key to empowering dental hygienists to secure their own contracts should they choose, provides Indigenous governments with a mechanism to hire dental hygienists, and in turn provide more equitable access to preventative oral health care across the Northwest Territories. Madam Chair, just last week, when the Standing Committee on Government Operations traveled with Bill 85, the United Nations Declarations on the Rights of Indigenous Peoples Implementation Act, a resident of a small remote community asked committee if passing Bill 85 would help their community access equitable health care, specifically dental health care, because a dentist has not visited their community since before the COVID-19 pandemic began, and the only dental health care seen in the community is through medevacs for oral abscess. The answer is no, but this bill, Bill 80, will help to create a path for this. Today, all Canadian jurisdictions, except the 3 territories and PEI, have legislation to support dental hygienists to be autonomous and self-regulated to varying levels, even those working in remote regions of Northern Ontario, Newfoundland and Labrador, and Northern British Columbia. It is also worth noting, Madam Chair, that this is also a decentralization and economic diversification conversation, given the employment opportunities this will potentially create outside of Yellowknife. Lastly, Madam Chair, I would like to respond to the 3 points raised by the Minister of Health and Social Services in her letter to committee dated May 4th, 2023. First, the letter identifies that the bill is inconsistent with the process outlined in the Health and Social Services Professions Act. But Madam Chair, this is what bills do. They amend bills to allow things to happen. Nothing in this bill is inconsistent with the statutory framework. This is simply a different way to get this work done. The current Act's process requires 2 members of the profession to identify a desire to be regulated. This means that busy working professionals, almost exclusively based in Yellowknife, would either need to want to be regulated or be aware of the Act's process, or somehow be aware of the unintended challenges experienced by residents in our most remote communities. As a lifelong Yellowknife resident, I only learned about the NWT challenges of accessing oral health care once I became an MLA. My advocacy was inspired by a constituent and then propelled by learning from the lived experience of my regular member colleagues. I want to respect the intent and purpose of the Health and Social Services Professions Act by ensuring this work is done under this Act, which is why Bill 80 makes amendments that drive the creation of regulations under the Health and Social Services Professions Act. Second, the second issue raised by the minister's letter is the interest from the profession. I understand and agree that interest from the profession is important. The current process is the Health and Social Services Professions Act stipulates that 2 health field professionals need to request that regulations be created. But this is not statistically significant of the entire profession. And while some want the autonomy and ability to choose, the regulations will need to honor and respect that others will want to remain in an employer-employee relationship as they exist today. It's important to remember that regulating dental hygienists is commonplace in most of Canada, and that we are ultimately talking about the health of Northerners. One of the key objectives of the GNWT's 2018 Oral Health Strategy calls for establishing systemic supports for improved oral health services, including improving the regulatory environment. This work still needs to be done. To remove systemic barriers to preventative oral health care for all residents of the Northwest Territories, we must first improve the regulatory environment that will support an autonomous preventative oral health care system. This work should not be held up by the process outlined in the current Health and Social Services Profession Act, and this bill helps move this work forward. I would also like to note here, Madam Chair, that through my research, I received great letters of support from the Canadian Dental Hygienists Association, the Dental Hygienists Association of Ontario, and the Dental Hygienists Association of British Columbia. Each association offered great feedback on their own regulatory environments, including lessons learned on what worked well and recommended improvements. I'd be happy to share this correspondence with committee if committee decides, and I believe I said this morning as well, just in case. The third point, and what I feel is the most significant point, is the issue of timelines, Madam Chair. The letter identifies 6 significant meaty pieces of legislative work that will not get done if this call for regulatory framework moves forward. I want to acknowledge the huge demand on the Department of Health and Social Services over the course of this assembly. From the incredible demand during the pandemic that has continued through endemic to the substantial legislative agenda that still lays in front of the department. And I want to thank the department for the work they continue to do with this committee. But healthcare is an evolving system, and the demands on renewal will continue. In the past, other GNWT departments experiencing significant demand on employee time and legislative timelines have tendered contracts for legislative and regulatory drafting to continue to meet its mandate. Madam Chair, equitable access to oral health care is not a new conversation within this House or this committee. Half of this standing committee started this conversation in February of 2020, the first full sitting of the 19th Assembly. In the Assembly before, access to dental care was raised by multiple members and is the Assembly during which the Oral Health Action Plan was tabled and whose goals have not yet been accomplished. So, while I respect and acknowledge that the department has a significant legislative and regulatory agenda, I ask how many more assemblies will Northerners need to wait for preventative oral health care? Madam Chair, I would like to thank you, committee members, and committee staff for your time today and would be happy to answer any questions committee may have. Thank you.
Thank you, MLA Cleveland. I'm going to open the floor to questions, and first on my list I have MLA Semler. Go ahead.
Yep, thank you, and thank you for the presentation, and thank you for the work that's been put into this. It's something that's near and dear to me. It's one of the first things that I raised in the House and discussed as member statements because of the work that I previously done working with an the Indigenous organization in my community. With this bill, being proposed, I think the thing is that what I more of a comment, maybe a question in there, but right now, when you look at the people that are less likely to have any dental care are our small communities, or even our regional centers, because of lack of services. Dentists are not easy to come by, just like doctors are not easy to come by, and we see that. And if we already know, like in the healthcare profession, like with nursing and things like that, we're struggling to find nurses. But it is one that we are promoting because we know having nurses and local nurses, and right now I think there's in the news, like, even providing grants now to nurses that are going to train and come back and work here. So when I look at the dental hygienist, it's in the same boat. Although it's a non-insured health benefit, the people that are covered under this service are Indigenous people. They are our most vulnerable. They are our kids. And when you look at the statistics, and I look at the Inuit Health Survey, who did track statistics, and it is in their report, and it's talking about kids with dental caries compared to, general Canadians. And you've got 6 to 11-year-olds at 93%, others at 56%. Adolescents, 12 to 17, 96% with dental caries, 58% in the rest of the country. So if we don't have anybody teaching dental hygiene in our communities, and we don't have access to dental hygienists doing the preventative care and the continuing of preventative care in our Indigenous communities, we're faced with multiple health issues. You know, we're putting children at risk by putting them into the operating rooms to have all their teeth removed. And are we sending a speech pathologist back to every single community? No, I don't think so. We don't have the money for that. We have it's just like we have a traveling dental. Well, right now in Inuvik, we don't have a dental clinic that's even open. So who's servicing the communities? Nobody. And according to non-insured health benefits, children between, you know, certain ages, they should be being seen and doing dental cleanings and things like that 4 times a year. I doubt if they're even seeing them once a year because of the issues that you raised, that emergencies are the ones that are being seen. So I want to thank the member for bringing this forward, and I am fully in support of this bill, and I am going to, you know, support this all the way through to the end. Thank you very much.
Thank you, MLA Semler. MLA Cleveland, would you like to respond?
Thank you very much, Madam Chair, and thank you very much to MLA Semler for the comments. When looking back in Hansard, back from the beginning of this assembly, back in February of 2020, it was MLA Semler, MLA Bonnet Rouge, and myself that spoke about dental care and access to dental care across the territory. And it was lived experience from members like MLA Semler, who had the honor of serving her communities and her people in the healthcare profession, and lived experience like MLA Bonnet Rouge from a small community who sees the struggle that his residents have and the people that he serves have in order to access this kind of care. And as MLA Semler said, this isn't just about physical health, this is also about mental health. And this is really a path forward for either Indigenous governments to be able to hire dental hygienists or avenues for preventative oral health care, and also self-employed people across the territory to jump on board and be a part of this solution. And so I thank MLA Semler for her comments today.
Thank you, MLA Cleveland. MLA Semler, did you have a follow-up? No. Okay, next on my list, I have MLA Bonnet Rouge.
Merci, Madam Chair, and merci to the presenter for her private member's bill for dental hygienists. I know many times in our small communities we're, you know, we're faced with a shortage of dental care in our communities, and that dental visits most times can be long and onerous in between, and most people are being sent on medical travel to the outlying communities. I know that dental visits, well, it's supposed to be, I think, I'm pretty sure about 6 months or so like this. How would the hygienists, if positions are created, be competing with federal dollars between the regular dentists and the hygienists? I'll ask that, Mussy.
Thank you, MLA Bonnet Rouge. MLA Cleveland.
Thank you very much, Madam Chair. So this bill here amends existing legislation in order to essentially force the hand of the government to create a regulatory framework under which dental hygienists could operate autonomously from dentists and be able to go out and secure contracts. But it doesn't speak to either the mechanism by which the federal government will fund this work. It doesn't speak to how, you know, who will do this work, but what it does is it creates the regulatory framework so that this work can happen independently of a dentist. Thank you.
Thank you, MLA Cleveland. MLA Bonnet Rouge, do you have a follow-up?
Yeah, I must say, I want to thank the member for bringing forward such a bill. As I stated, we need as much dental care as we can, as she pointed out. That many diseases can happen from teeth, and our Indigenous communities are the ones that suffer the most, as we're just a second thought to many of the organizations on treating our people. And I applaud the member for bringing this forward, and we'll be supporting it, Mussy.
Thank you, MLA Bonnet Rouge. MLA Cleveland, do you have a response?
I appreciate the support of Emily Bonnet Rouge. Thank you.
Thank you. Next on my list is MLA Johnson.
Thank you, Madam Chair. I guess I want to speak to the concerns raised by the Department of Health and Social Services. I somewhat sympathize with their concerns that they have a lot of policy and legislative work. That's a tough one always. It prevents them from doing a lot of work that would relieve pressure on the healthcare system that causes them to be so busy. I think this is kind of very similar to the department agrees to give pharmacists more power to prescribe, to take some of that burden off of doctors, and they just haven't got around to it. They want to do it, but it still seems to be years away. And I think this one kind of falls in that category. It's 8th on the list of priorities for a very busy department. But I guess my question though is more on the concern of there is a process where people can ask to be regulated. And there's a two-part question. Does the member know of any dental hygienists who will actually take this up? Like, this seems all for naught unless at the end of the day, once they're allowed, a dental hygienist is actually going to go out on their own and start traveling to home communities and start trying to bill NIHB, which is a disaster and very difficult, and start their own practice. Do we know that there are dental hygienists who want to do that? And if there are, why don't they simply just write the minister and initiate the process that allows them to become regulated? Why do we have to have this step here? Thank you, Madam Chair.
Thank you, MLA Johnson. MLA Cleveland?
Thank you very much, Madam Chair, and a huge thank you to the member for that question, because I think it's a really important question. I'm very excited for the member to also hear the presentation that will come after mine, because there is a dental hygienist sitting behind me right now who is also the dental hygienist who brought this forward to me so that I was aware of the challenges faced not only by the profession but people living outside of Yellowknife in the Northwest Territories. And the person sitting behind me is also not the only dental hygienist who is prepared to support this work in the Northwest Territories. But just for sake of transparency, what happened in the course of this assembly is this conversation started very early on in this assembly, and the feedback that I received is this is going to be a great private members bill, take it forward. And so in working on kind of building a private members bill and trying to do a lot of the work myself, what I realized was that a lot of the work that needs to be done does not belong in legislation, it belongs in regulations. And so in doing that work, I sat down with the Department of Health and Social Services, and it wasn't until much later in the conversation with the minister in November of 2022 where it was raised to me that this isn't work that needs to be done to the actual existing Dental Auxiliaries Act, it's work that needs to be done under the Health and Social Services Professions Act. And so in that time, there's 2.5 years there that really, unfortunately, ground was lost. And if I didn't even know that as an MLA that that's where that belonged, how are dental hygienists across the territory supposed to know that that is the process by which they would need to take in order to be regulated? And that's what led me to kind of deciding to go the route of forcing the hand of Health and Social Services to move this forward. And I absolutely want to acknowledge what Emily Johnson has said as far as timelines and priorities of the department. I absolutely agree that everything that was in that letter, from Health and Social Services are definitely priorities that I want to see move forward. There's things like the Pharmacy Act that I've also been going back to them on for really creating a larger scope for pharmacists to be able to work under. There's the regulations for midwives that I really want to see move forward. It's all really important work, but what part of someone's health and safety gets to take a priority? And I would say that unfortunately all of it, and maybe this needs to be work that is done not in a traditional way of the department and is done through a tendered contract so that it gets done. Thank you.
Thank you, Emily Cleveland. Follow up, Emily Johnson.
Yeah, Yeah, I guess I accept Emily's argument. You know, we don't, many of us don't know government processes or how to navigate things. I don't know how you would initiate a process to become a regulated profession and then convince the department that it was a priority to finish those regulations. I remember the Minister of Health before she was the minister was in support of this, and I've heard many conversations of it. So it just kind of seems like we've been talking about it for 4 years, and if this is the final thing that has to make sure it actually happens at the end of our very, very long processes, then I guess I will support it. Thank you.
Thank you, Emily Johnson. Emily Cleveland, did you want to respond to that?
Just that I would like to thank the member for his support. Thank you, Madam Chair.
Thank you. Next on my list, I have Emily O'Reilly.
Yeah, thanks. Madam Chair, yeah, I believe in private members' bills. I had a successful one in the last assembly. I have one before the House now as well. And you know, these are important tools when Cabinet can't or won't make changes. So I do believe in private members' bills. And even if this one doesn't go forward or doesn't get passed, there's a lot of value in having the public debate itself. So hats off to the member for doing this. I know nothing about dental hygienists other than I go to see one every once in a while, and I really don't like people poking around in my mouth, but it's a very important public health service, and it should be a right in Canada, and hopefully the feds at some point will provide funding for this to make it happen across the country as part of public health care. But I don't really understand anything about dental hygienists. Can you tell me, and maybe the people coming after you will tell me more, but how many of them are there in the Northwest Territories? Is there a professional association now, or are they part of other provincial associations? And I noticed that you've got letters of support from the BC and Ontario organizations. Is that because we don't have one in the Northwest Territories? And of course, the purpose of this is to try to help spur on them as a regulated profession. But tell me a little bit more about how many are here and how they're organized and regulated. Thanks. Currently, thanks.
Thank you, Member O'Reilly. MLA Cleveland.
Thank you very much, Madam Chair. Madam Chair, I knew one of my colleagues was going to stump me today. The numbers I brought with me today are not related to the number of dental hygienists in the association. The numbers I brought were related to who are dental hygienists in the Northwest Territories, because I figured that one might come up as more of a gendered question. So I can commit to getting that information, and it is easily accessible on the website, and so I will pull that off, and I will commit to getting that to committee. As far as the question about associations, there is not a dental hygienist association of the Northwest Territories currently. There is a dental association of the Northwest Territories, and so this would add, I guess, kind of a layer of difficulty to the work of the department, in that they would have to go out and ask independent dental hygienists to participate in helping to create this regulatory framework. The reason that I also reached out to dental associations, dental hygienist associations, across Canada, is because, first of all, there is a Canadian national body or association that does that work, and I wanted their feedback. But then I also went to jurisdictions that would have similar intricacies as us in the Northwest Territories. So, for example, Northern Ontario has a lot of remote and rural communities that would be experiencing some of the same challenges and difficulties of the Northwest Territories, and I'm incredibly thankful for the feedback that I received from all of the associations. They were very encouraging of the Northwest Territories potentially updating their regulatory framework here in the territory, and also very helpful with lessons learned on what they wish they had done differently. Thank you.
Thank you, Emily Cleveland. Follow-up, Emily O'Reilly.
Yeah, no, thanks for that. If you have any cross-jurisdictional information that you could share with the committee, I think that would be helpful. I guess I read the letter from the minister, and I don't think there's any, maybe there is some disagreement on how the profession should be regulated, but I don't think I think there's some shared objectives of getting better dental care for everybody. It's a question of how and when we're going to get there. And I'm just wondering, in your discussions with the minister, whether she has indicated in any way whether there's a timeline for them to actually do this at some point, and how they prefer to have it done. I think some of that might be is covered in the letter, but any indication from them or from the minister about the timeline that they have in place for this? And I think committee probably needs at some point to hear directly from the minister on this, but I'll ask the sponsor of the bill, please. Thanks, Madam Chair.
Thank you, Emily O'Reilly. Emily Cleveland?
Yeah, thank you for that, Madam Chair. To the member's first request for a cross-jurisdictional scan of dental hygienists across Canada, I can definitely send that into committee. And then in regards to conversations around timelines with the department, there was an indication of a more preferable timeline that was sent in the public letter to committee. One of my concerns is that there is work that was intended to be done in this assembly that is being pushed into the 20th assembly. And so with that, that also ends up pushing back the timeline on the regulatory framework or any regulatory framework that would come forward as a request under the Health and Social Services Profession Act. And so as far as commitments, it's really hard for the minister to provide that commitment given that our time here in this assembly is ticking down. We have until essentially the end of August, and the minister wouldn't be able to provide any direction to a department beyond that time frame. Thank you.
Thank you for that, Emily Cleveland. I just also want to point out for myself that I find it interesting, or when I moved north, that I could go to the dentist and have work done by someone who is actually not a dental hygienist, but then we don't empower actual dental hygienists to be more autonomous. So it just struck me as a little bit of a thing. So it's fine to allow, you know, people that aren't in that school, but to be trained under dentists to do work on people generally here in Yellowknife, but not, you know, sending out people that have the training into communities. I don't know that there's any other questions. Emily O'Reilly, do you have another question? So at this point, we're going to thank Emily Cleveland for appearing as a witness, and we're going to move over to Mr. Todd Orvitz online, just as he has a scheduling commitment, so he's been patiently waiting, and then we will move to the audience participation. So thank you for that. Okay. Mr. Orvitz, do you hear me?
Sure do. Can you hear me okay?
Sure can. The floor is yours. Please go ahead.
Much appreciated. Thank you for the opportunity, and thanks for accommodating the scheduling. If I did have the ability to wait, I really appreciated hearing what was said prior to me. I think that was far more articulate than I will be, but I think very consistent with the position of the Inuvialuit Regional Corporation. It was excellent to hear all that information. I do also want to just say that we are in the process of preparing a written submission. You're probably all familiar enough with IRC to know that we have a ton of talented staff members, and I'll make sure that our staff team puts together a far more detailed response than I'll give you today. But with the opportunity to articulate our position on this, I didn't want to miss the chance to come to the committee and speak to how important this is for our region. Obviously, MLA Semler has articulated the interest in this region extremely well, but I can tell you from the Indigenous governing bodies perspective in this region, from IRC's specific perspective, this legislation is extremely valuable. It provides us an opportunity really to access far better services, far more services, far more frequent services, and across all of our 6 Inuvialuit settlement region communities. Partly, what it does allow us to do, potentially, is not just access additional resources from the GNWT, but would allow us to access additional health promotion dollars from our federal government colleagues. So I think it's really important for the Assembly to be aware that this is not just a policy change that's going to affect things for the GNWT. This is a policy change that's going to allow IRC to do our job as the Indigenous government in the region to access additional sources of funding at no cost to the GNWT to enhance the quality and level of services that are being provided. I mean, it goes without saying, and you've heard it already, that just about everywhere else you can go and access dental hygienist services without a dentist in place. This is one of the only jurisdictions where that's not the case. I've been to this committee before. I've talked with you about some of the challenges that are unique to the government as it's currently established. I think that this is another one that there's a very real opportunity for us to make some significant change and to do it pretty quickly with a pretty simple stroke of a pen. I'm hopeful that the limited time available to the Assembly is used to effect this change. It would allow us as IRC to hire our own dental hygienists. It would allow us to bring services into our Nunavut communities in a far more expeditious way. It would allow us to leverage Indigenous Services Canada dollars in order to do that. So you're looking at a net increase in the overall level of service being provided in our region, and it's something we support extremely strongly. MLA Semler brought this up, so I don't want to be repetitive, but I do think it's important to articulate again, especially given that I am here representing IRC. The relationship between teeth and mental health is a very significant relationship, and the ability to access dental services in the Nunavut settlement region right now is basically nil. And so the mental health consequences that go along with not being able to access oral health services and health promotion services through oral health are impacts we're seeing across our region. I don't need to brief this committee, I know, on the significant mental health challenges that we face here in the Nunavut settlement region, but across the NWT generally. The opportunity to enhance the overall frequency, quality, and level of service through this bill I think unequivocally will enhance the overall mental health of youth and young people in our region, absolutely. I've heard different comments from the minister saying that people aren't really asking for this. I represent IRC, we are asking for this. We represent the interests of beneficiaries in the Nunavut. We are asking for this. There's an opportunity to enhance quality of life for people in our region. And unlike others, I will be making every effort to make sure that I am doing that when I have the chance to do that. And that's the reason that I'm here today. Like I said, we are going to submit a written response, but I wanted to be on the record as fully in support of this bill and letting you guys know that whatever can be done to help enhance your ability to push this through, I'm ready, willing, and able to do that.
Thank you, Mr. Orvitz. We appreciate that. I believe there is one MLA with a question for you, and it is MLA Semler. Please go ahead.
Marceau, just a thank you for presenting, and I look forward to the written response that will enhance our committee's report on this bill and being able to move it forward. Because, you know, even though like that you say that this will enhance and better the lives of Indigenous Inuvialuit in the settlement region, I think once the changes happen here, it will be able to be replicated and, you know, and shared. And that's what we do as Indigenous people. We share what things work, and we will be able to share those things with other regions that are struggling, like my colleague, Mr. Bonarouche in the Decho and other small communities, to say this is how we were able to access the dollars and run these programs, and hopefully that they will be able to benefit from this as well. Thank you.
I much appreciated that, MLA Semler. I think that's extremely important to hear. I think that I will, as part of my written submissions, provide our ITK document. ITK obviously is our national Inuit body. This has been on the radar of the national Inuit body for a long time. You can see that the positions taken back in 2013 by ITK are positions that are consistent with what this bill is trying to do in our region today. So these efforts have been long-standing. So again, the point that this has not been asked for, I think, is something that really needs to be challenged directly. I will say, as MLA Semler noted, that you know, if hygienists were able to practice within the scope of their skill set without that clear dental oversight, we'd have prevention services in community regularly. Our wait lists would decrease. The need for emergency services would decrease with it. Having a dentist provide oversight, they don't need to be here in person. They need to get paid. And so that starts to make it more challenging, costly, and we have less services available here. So, I mean, the stuff is pretty long-standing and straightforward, and I'm really looking forward to getting something written. But as much as you said thank you, MLA Semler, I just want to thank you and your team there for the work that you guys have done to advance this, and know that IRC is an ally standing shoulder to shoulder with you. Thank you very much.
Thank you, Mr. Orvitz. I think you compete with me for the fastest speaker in the room sometimes, but we do appreciate that. I do also want to say, as someone who has had extensive dental work myself over the years, braces and such, the piece on mental health and your teeth is one that, you know, I hadn't probably really thought of in support of this, but is a huge point. And just speaking with a young man from a community yesterday who is getting his front teeth pulled at the age of around 38, and you know, knowing that he's going to have to wait for replacements and dentures and such, and it's, you know, it is a very valid point. So thank you so much for presenting. I think that's it for our questions for you. We appreciate you hanging around on the line. I know that you're a busy man, so thanks so much.
Thank you very much. Much appreciated. Talk to you all soon.
And next we are going to have a member from the audience come up, Nadia Lenny, if you could come forward and join us. That would be great. Nadia is with the Fireside Dental Clinic, and I'll just have you introduce yourself and then just go straight into your remarks. Thank you.
So, Madam Chair and committee members, my name is Nadia Lenny. I'm a registered dental hygienist and denturist in the Northwest Territories. I've practiced in the dental field here for more than 20 years. I was born and raised in Yellowknife, and I'm a registered Indigenous woman. Over the last 20 years, I've provided oral health care and education in Yellowknife and surrounding remote communities. As a dental hygienist, I've worked with and for several dentists. As a denturist, I run my own business. I am here today to provide comments on the proposed bill which would see the regulation of dental hygienists under the Health Professions Act. I am not an expert on professional regulation or on legislation, but I do have experience and views on how oral health care can be improved. As I mentioned earlier, I run my own business as a denturist. That option was not available to me as a dental hygienist. Under the Dental Auxiliaries Act, dental hygienists are required to legally work for a dentist who assumes professional liability. There are dental hygienists who are happy with this arrangement, and it should be maintained. However, I believe that if dental hygienists had the option of working independently, there would be a greater number of hygienists in the North. Allowing for a hygienist the opportunity to work independently as a regulated professional would provide more career opportunities and improve oral health in the North. Hygienists could operate their own business, travel into communities, work for the GNWT or other organizations to deliver dental care. The government and Indigenous governments could hire hygienists without having them work under direct supervision of a dentist. I believe the issue is scope of practice. Dental hygienists are regulated already. Dental hygienists who register with the Canadian Dental Hygienists Association of Canada acquire professional liability insurance in the sum of $2 million. This is the same coverage that is provided by dentists. If how we are regulated needs to change to broaden the scope of practice to allow hygienists to operate independently, then I support that. However, it is important to note that regulation should not be too restrictive or expensive. I'm not saying that all hygienists should not work under indirect supervision of a dentist. This works well for those working in a dental office. However, dentists who obtain contracts for communities are expected to provide hygiene services, but there are long wait lists to see dentists. Most patients that require emergent care and prevention and hygiene services are not offered as often as they should be. I have had the opportunity to work under a dentist, and I would travel to 6 different communities. Sometimes I would visit each community for every 3 to 4 months for weeks at a time. Patients, including adults and children, were motivated. I was seeing drastic improvement in overall oral health care. The demand was so great that I had wait lists and looked forward to returning to each community to measure the progress. However, this was not something I could do on my own. This kind of care could be delivered by hygienists working independently if the NWT allowed it. There are other jurisdictions in Canada where hygienists can work independently. This is not new, and it is time for it to happen here in the NWT. Thank you, Madam Chair.
Thank you very much, Ms. Lenny, for your presentation and for joining us here today. First on my list, I have MLA Johnson, if you're open to taking questions. Yeah, go ahead, MLA Johnson.
Thank you. I think you said you were currently practicing as a denturist. Can you just tell me what that is? Thank you.
A denturist is somebody who provides dental or denture services for people. So I fabricate custom dentures in the Northwest Territories for all of the NWT residents. And I'm also the only denturist in the Northwest Territories.
Thank you, Ms. Lenny. MLA Johnson, do you have a follow-up?
No, learned something new today.
Thank you so much. MLA O'Reilly?
Yeah, thanks. I hope I never have to see you in a professional capacity. But how many, can you tell me, and I'd asked the bill sponsor, like roughly how many dental hygienists are there in the Northwest Territories? And I don't need a precise count. I'm just trying to figure, is there like 20, 50? I have no idea. And then maybe just describe a little bit about the national organization, what it does, and whether there's kind of, is it a self-regulation body, or how does it work? Thanks.
Thank you, Mr. O'Reilly. Ms. Lenny?
This is a rough guesstimate, but I believe there's about maybe 25 to 30 hygienists in Northwest Territories. Oh, 36. 36. It's been a while since I checked. And the Canadian Dental Hygienists Association, we have the option of becoming members of it for a fee. Their job is to promote oral health care, provide us with resources, tools, and programs to be able to educate the public. They also provide a lot of continuing education for people, so we can register for courses with them. And there's also a section on if you want to become an independent hygienist. There's actually a little program there for us to take if we wish to be regulated.
Thank you. Mr. O'Reilly, do you have a follow-up?
No, that's really helpful. Thanks very much.
We're always big on not reinventing the wheels, so I'm sure we'll all take a look at that. Next on my list, I have MLA Semler.
Yes, thank you, and thank you for the presentation. Although I can't see you, I can only see the chair on the Zoom meeting. My question is in regards to the comment that, you said you don't know for sure if there's 25 or 30 dental hygienists in the Northwest Territories. And as an Indigenous dental hygienist and denturist, do you, when I think of nursing, that's my background, and I think of, if I didn't live in Inuvik, I wouldn't be able to, my career path to become a nurse in a small community, if I was, say, from Tuktoyaktuk, for instance, would be a lot longer, and I wouldn't, necessarily feel like that might be a job that I might want to go down, because it's going to take me so many years to get back into my home community to work. So when I think of 25 to 30 dental therapists in the North, there's probably majority of them are working in the regional centers. I don't believe there's any working outside the regional centers. And if this change, do you feel that this change might increase, like, as a community, like if I was graduating from high school, this could be a career that I could look to going out to, because then I can return home to my small community as an Indigenous dental hygienist, work with the students, work with the place I grew up, and try to make a change within my community. And I'm just wondering if you feel that, this is something that, you standing here as an Indigenous hygienist would support.
That's something I was talking to with somebody the other day about, is what could we do for hygienists and denturists in the Northwest Territories, is to discuss with schools to perhaps reserve a few seats and then start to promote these professions, because I'm the only denturist in the NWT, and we definitely need more, but most people don't know what a denturist is. Same with dental hygiene. I think if people had more options, we could be encouraging more entrepreneurship in the North for people. Businesses could be started to start traveling remote communities. Also make it legal to work directly for the government in health centers or schools as well. And I definitely believe that with a little bit of awareness, that people would be more interested in going into it.
Thank you, and I agree with that. Anytime you can maybe present an option that's not a 4-year program, that people would be, or 6, I guess, to be a dentist. Yeah. Lisa, do you have, or sorry, MLA Semler, do you have a follow-up?
Yeah, no, I think that's kind of where I'm coming from. And then we had a previous presenter who you probably heard, is that, as an Indigenous person, I could potentially just kind of go and say that this is my career goal, and I'm going to go back and I'm going to work for my Indigenous organization and support this if this is a goal for my community. And I think, hearing what you're saying is that, you know, there is like the people probably enjoy seeing you in the community as an Indigenous hygienist, the kids, you know, and I think that when I talk about nursing and different frontline positions, that, you know, it's the comfort of seeing your own people and seeing, you know, that, and you know, and the cultural respect that the two have, and knowing that you're probably dealing with a lot of kids that have had traumatic experiences because of dental surgery and things like that. So yeah, I just wanted to just kind of say thanks for presenting, and I'm hoping that with this bill we'll be able to increase that work in our small communities, not just in our small communities, but even our regional centers. Because right now, like I was saying, in Inuvik, we don't have any dental services right now. There's been a gap and it's really impacting all our surrounding communities right now. So I think this is going to be something that's going to make a difference in the long run. Thank you.
Yeah, and it's not just, you know, your teeth as well. There's definitely cancers and things that dentists and dental hygienists, you know, identify. So I do agree with that as well. I think that does bring us to the end of our questions, unless anyone in the room, nope. So we're looking at, thank you so much, Ms. Lenny, for presenting today. I know it's always a little intimidating, and you're taking time out of your personal schedule. I'm sure people would like to book time at noon with their dental hygienist, so thank you very much. Excellent. So this now actually concludes unless there's anybody else, but I don't think so, that would like to present in the audience, that we will conclude the public portion of our meeting. If anyone has any further comments or would like to submit their thoughts on this bill, please submit them to committees@ntassembly.ca. That was committees with an S at ntassembly.ca. And that will be the end of our live portion of this broadcast. Thank you.